Alright, here we have another 70 questions, this time in biochemistry. Let's have a ton of fun going through these 70 USMLE biochemistry questions. You'll soon have your own access to these questions and thousands of others as I update them to my new free question bank, so stay tuned for that. You're also going to find awesome review sheets for all of these questions, so you can easily review all 70 questions in 5 minutes or less. So stay tuned for that as well. In the meantime, let's begin. Here in question 1, we have a 30-year-old woman who comes to the clinic for her SARS-CoV-2 mRNA vaccine, so Pfizer and Moderna. But of course, on the USMLE, we don't have trade names, so we call them the mRNA vaccines for COVID. The question's asking how these vaccines are introduced into the host cell. So this is a great question because it ties together biochemistry, immunology, microbiology, pathology, and pharmacology. And by the way, COVID questions do show up on the exam, so we gotta know it. The mRNA vaccines work by introducing an mRNA encoding spike protein, and this triggers the immune system to recognize the spike protein as a foreign antigen. And here's just a picture of the spike protein, the S protein on COVID, attaching to the ACE2 receptor. That's a high yield point, by the way, that COVID attaches to the ACE2 receptor. And we could see a video of that over here. This is how COVID gets into the host cell. Alright, question 2. Here we have a 7-year-old boy who has abdominal pain, vomiting, and diarrhea after going to a family picnic where he ate mushrooms. There's only one mushroom that shows up in biochemistry, and that's the alpha-amanitin mushroom. But let's read further. We see the presence again. That's right, we see the presence of alpha-amanitin. In the biopsy, what was most likely impaired? So the alpha-amanitin mushroom is associated with RNA polymerase II, and what was impaired was synthesis of messenger RNA. Remember, RNA polymerase type 2, synthesis of messenger RNA. And this is probably my claim to fame, my first video on YouTube on the RNA polymerase types 1, 2, and 3, and that was represented by the mnemonic roommate. R for RNA, M for mRNA, and T for tRNA. That messenger RNA is associated with RNA polymerase type 2, and the A for alpha-amanitin. If there's one RNA polymerase type you want to remember, it's 2, at least for exam purposes. Alright, question 3. Here, we have the oxygen hemoglobin dissociation curve moving to the right. Which of the following conditions would move the hemoglobin curve to the right? Remember, when you move to the right, there's more delivery, and that would be caused by increased temperature. And you can read about that over here, but I prefer the mnemonic cadet faces right. The 5 conditions which move the oxygen hemoglobin curve to the right because there's more delivery. It's easier for hemoglobin to release the oxygen. And here's just a visual where we see the cadet actually facing right. Cadet faces right, the 5 conditions that allow for better oxygen delivery. Alright, question 4. Here we have a 22-year-old woman who has fatigue, weakness, and pale skin. And we can see from the question that she has defective heme synthesis, so she doesn't have proper oxygen delivery. But we don't need all of this, we just need the last sentence. Which amino acid is required in the first step of the heme synthesis pathway? And the answer is glycine. Glycine and succinyl-CoA form the first step of heme synthesis as they produce ALA by the enzyme allosinthase. Hence my video where I have the sucking He for succinyl-CoA and the gliding C for glycine producing ALA or Aladdin on acid, ALA acid. Alright, question 5. Here we have a medical student studying neurotransmitters, but basically what we want to know if there's a relationship between tyrosine and serotonin. Well, let's see. Tyrosine produces dopamine, and serotonin doesn't come from dopamine, it comes from tryptophan. So therefore, tyrosine doesn't directly lead, of course, to serotonin synthesis. So the most accurate answer would be tyrosine indirectly affects serotonin synthesis, because tyrosine produces dopamine, and dopamine indirectly can affect the production of serotonin. But again, it's not direct, since serotonin comes from tryptophan, as we write over here. And here's the pathway of tryptophan for serotonin. This is extremely high yield. That tryptophan is used to make serotonin, which is basically interchangeable with 5-hydroxy-IAA. I have no idea how to pronounce that. Alright, question 6. Here we have a really exciting question, because this is actually a case that happened in history in 1985, a famous case. Let's talk about it. We have this 18-year-old woman who's brought to the ED by her parents with agitation, confusion, diaphoresis, and tremors. She was on a monoamine oxidase inhibitor for depression, and she was given meperidine for pain relief. Actually, in the true story, there was also some evidence of cocaine use, but we'll leave that out over here. Basically, her symptoms began to worsen, and she got hyperreflexia clonus and increased muscle tone, i.e. she got serotonin syndrome. So what's the pathophysiology of that? And the answer is excess serotonin in the CNS. Remember, this 5-hydroxy thing, here, 5-hydroxytryptamine, is serotonin. So this is serotonin syndrome, and this is the famous case, you can read about that over here, but this is the famous case of Libby Zion, where her father was furious at the residents for what he claimed was negligent. But it's actually for this reason that residents have a limited number of hours that they can work during the week so they get the proper sleep and don't oversee important medical considerations that could put a patient's life at risk. Again, serotonin syndrome, the Libby Zion case. All right, question 7. Here we have a 20-year-old man who has muscle cramps and fatigue after exercise. There's elevated serum creatine kinase and myoglobinuria following exercise. And the muscle biopsy shows an accumulation of glycogen. So here we have a problem with one of the glycogen storage diseases. And here it's the 5th one. And that's glycogen phosphorylase, a deficiency in glycogen phosphorylase, i.e. myophosphorylase, as this is McArdle disease, glycogen storage disease type 5, which I only remember with the mnemonic with this guy over here, with the McDonald's shirt, McDonald's for McArdles. And the phosphorylase for phosphorylase, myophosphorylase, is the enzyme which is deficient. And the cola reminds me of the cola-colored urine for the myoglobinuria. And we can see that this guy has fatigue and weakness, perhaps because he was just working at McDonald's and he got very, very tired. And that's exactly what happens in McArdle's disease, fatigue and weakness after exercise. And here we just compare the 6 glycogen storage diseases that we need to know. If you want, you could leave out type 7 because it's never tested on, but for sure, 1, 2, 3, 4, and 5, you gotta know. But don't worry, we have mnemonics for all of these. Question 8. Here we have a 3-year-old boy who bites his fingers and lips frequently, and he has uric acid crystals in his urine. Basically, he has high uric acid levels. This, of course, is Lesch-Nyhan syndrome, which is due to HGPRT deficiency, hypoxanthine guanine phosphoribosyl transferase, HGPRT, which you can read about over here. And here's the pathway which is involved. You could take a look. Remember, it's the inability to produce IMP and GMP by HGPRT, which leads to elevated levels of hypoxanthine and guanine, which produce downstream the uric acid crystals, since they're converted to uric acid. And again, for another fun mnemonic, here we have the leashed ninja for Lesch-Nyhan, who's really upset. So he's biting his fingers for self-mutilation because a huge part of his home is destroyed for HGPRT, and we see the elevated unicorn with acid for elevated uric acid. And of course, this is X-linked recessive. That's why we see the small X on his ninja suit. Question 9. Here we have this woman with night blindness, peripheral neuropathy, and gradual loss of sense of smell, retinitis pigmentosa, ataxia, and dry scaly skin rash. We still don't know the answer, but then we see elevated levels of a specific branch-chain fatty acid in her blood and urine. So it's a problem with the peroxisome. Well, we see there's Zellweger, Refsum, and this one is Refsum. Refsum disease, which is due to deficiency of phthanic acid alpha hydroxylase. Phthanic acid alpha hydroxylase is the deficient enzyme in Refsum syndrome, and it leads to these symptoms, which you can read about over here. Again, retinitis pigmentosa, peripheral neuropathy, and ataxia, as well as sometimes anosmia. Now, the reason why I pointed out choice C, ribose 5-phosphate isomerase, is because the deficiency of this enzyme is quite fascinating, that it's the second rarest disease of all time, only 4 cases recorded in history. And here's just a snippet from my video on Refsum disease, the referee with the sum for Refsum, and we see that he has Reese's chocolate on his arm for autosomal recessive, as it's inherited in autosomal recessive fashion. Question 10, here we have a 5-year-old boy who has vomiting lethargy and a sweet odor in his urine and sometimes in his ears. This is maple syrup urine disease, as we see, confirmed by the elevated levels of leucine, isoleucine, and valine, the branch chain amino acids, and therefore there's a deficiency in branch chain alpha keto acid dehydrogenase. Maple syrup urine disease, and remember, it's not just the urine that's like maple syrup, it could sometimes even be the ears, the earwax, so keep that in mind. You can read about that over here, and here's just valine, leucine, and isoleucine, the amino acids that can't be broken down in this condition, and therefore management involves avoiding these amino acids in the diet. Question 11, this is just asking us what's a key event in the intrinsic and extrinsic pathways of apoptosis, and that's the activation of caspases. You could take a look at that over here, that both pathways converge on the activation of caspases, and here's just a nice representation of the apoptosis of the intrinsic and extrinsic pathways that they converge on the activation of caspases. But as for the other choices, you could read about them in the previous slide over here, and more, by the way, in my question bank. Question 12. Here we have a patient with fatigue, pallor, and shortness of breath, so that might be anemia, and we see a mildly swollen tongue, so it's most likely we're dealing with either vitamin B12 or a vitamin B9 deficiency, but it's saying that vitamin B12 levels are normal. This is most likely a vitamin B9 folate deficiency. What are the values in folate deficiency? Choice A, MCV will be elevated, and homocysteine will be elevated. And that's true for both vitamin B12 and for vitamin B9 deficiency. And this is because these enzymes are both required for cell division, but if we have fewer cell divisions, the red blood cells will remain larger, i.e. elevated MCV, bigger than 100. Homocysteine will be elevated, but in terms of methylmalonic acid, only in vitamin B12 will this be elevated. In folate deficiency, methylmalonic acid levels will be normal. And that's because only vitamin B12 is required for the breakdown of methylmalonic acid, so without vitamin B12, methylmalonic acid levels will be be elevated. But folate deficiency has nothing to do with methylmalonic acid. So therefore, in folate deficiency, methylmalonic acid levels are totally normal. This is an extremely high yield fact. All right, here we just have a fool who is late to his appointment, folate deficiency, and we have the large red blood cell for elevated MCV, and in the back we see the home for elevated homocysteine. But again, we see nothing about methylmalonic acid because methylmalonic acid levels will be normal. Question 13. Whoops, I gave it away already. Sorry about that. This was Pompe disease, where we see acid alpha-glucosidase deficiency leading to hypotonia and cardiomegaly, Pompe disease. And then we have the baby with the pump with the cardiomegaly, Pompe disease, where the baby we see over here is weak and has hypotonia. Question 14. A woman with dementia, diarrhea, and dermatitis. This is pellagra. Vitamin B3 deficiency, niacin deficiency, which you could read about over here, the 3 Ds. And here we see the pelican with dermatitis, diarrhea, and dementia next to the 3 Bs for vitamin B3. Vitamin B3 deficiency, pellagra, pelican for pellagra. Question 15. Here we have a 34-year-old man with headaches, dizziness, and blurry vision due to his hypertension, and there's a solid mass in the left adrenal gland, and he has a hemangioblastoma. And we do genetic testing, which confirms the diagnosis. So this is a genetic disease. Well, let's see. Hemangioblastoma and something in the adrenal gland. This is von Hippel-Lindau disease, which you could read about over here, has hemangioblastomas, renal cell carcinomas, and pheochromocytoma. And it's on the VHL gene, and I'm pretty sure chromosome 3. And here we have the van with the hippo from London for von Hippel-Lindau disease. And this hippo over here has a pheochromocytoma, has a brain hemangioblastoma, a renal cell carcinoma, and thus he has hypertension. The little guy with hypertension over here. And this is on chromosome 3. Von Hippel-Lindau disease. I hope you like this picture. Let's move on. Question 16. Here we have a girl with calf ileus spots and Lynch nodules. This is just NF1, neurofibromatosis type 1, and it's associated with malignant peripheral nerve sheath tumors. And I wrote in the box over here, as well as optic gliomas, neurofibromatosis type 1, and this occurs on chromosome 17. All right, question 17. We have this 45-year-old man with mood changes, chorea dystonia, and bradykinesia, and there's a CAG repeat expansion on HTT. This is Huntington disease, and lots of Huntington disease patients commit suicide because of their major depression. And one thing to remember about Huntington disease is the anticipation. They love to ask on exams on the anticipation, where sons get the disease earlier than their father. Question 18. I'm sorry I gave it away again. Aortic dissection. This is a girl, a 16-year-old girl who has poor wound healing and joint pain. She has hyperextensible skin and hypermobile joints. On the COL5A1 gene, this is Ehlers-Danlos syndrome, and patients are at increased risk of aortic dissection due to the weakness in the connective tissue. This affects the integrity of blood vessel walls. All right, here you have a 5-year-old boy who has hand flapping and speech delay, and there's a CGG trinucleotide repeat in the FMRN1 gene. This is Fragile X, and this is associated with autism spectrum disorder, especially when it's not a full-blown Fragile X. That is, there are fewer, that the CGG trinucleotide repeats is on the lower end of the spectrum. No pun intended. And you can read about that over here. Question 20. Here we have a 2-year-old girl who has elevated glycosaminoglycans, not GAG repeat, glycosaminoglycans, and there's a deficiency of alpha-L iduronidase. So this is either Hurler or Hunter, and I have a video on the difference between the two, but in either one, there's elevated dermatan sulfate and heparin sulfate, which you can read about over here. Here is actually Hurler syndrome. So again, elevated dermatan sulfate and heparin sulfate. Question 21. A 4-year-old boy who falls a lot and has the Gower sign, and CK levels are elevated. This is Duchenne, and Duchenne is associated with cardiomyopathy, and you can read about that over here. Duchenne, Gower sign, cardiomyopathy, dilated cardiomyopathy due to the progressive degeneration of cardiac muscle. And make sure you remember the pseudohypertrophy in the calves. Question 22. A 5-year-old boy who's very talkative and friendly with strangers. He has a heart condition, and there's a deletion on chromosome 7. This is Williams syndrome, and patients with Williams syndrome have hypercalcemia, and you can read about that over here. But don't forget the elephant faces, the friendliness with strangers, and the supravalvular aortic stenosis. I actually know a patient who very recently got surgery due to Williams syndrome, supravalvular aortic stenosis, and now is doing fine. Question 23. This 12-year-old boy has delayed wound healing, lots of infections, and lab values show elevated DATP levels. This is affecting purine metabolism. This is adenosine deaminase deficiency. So of course the deficient enzyme is adenosine deaminase, which you can read about over here, that the elevated DATP is toxic to lymphocytes and results in immunodeficiency. This is the most common autosomal recessive cause of SCID. Question 24. Here we have this 10-year-old boy who has fatigue, pallor, and jaundice, increased MCHC. For the purposes of the USMLE, there's really only one condition that has increased MCHC, and that's hereditary serocytosis. And that's what's going on over here, and that's why the peripheral blood smear shows serocytes, and that could lead to gallstones, which you can read about over here. This is due to the chronic hemolysis and increased bilirubin production. Question 25. We have this newborn over here who has microcephaly, polydactyly, rocker bottom feet, and there's an extra chromosome 13. This is trisomy 13. Patau syndrome, and Patau syndrome is associated with things that go down the middle: cleft lip and palate, heart conditions, ventricular septal defect, and in this case with the brain, holoprosencephaly or holoprosencephaly. And you can read about that over here. This is Patau syndrome. This is a severe congenital anomaly. Question 26. 15-year-old girl who has symptoms of Turner syndrome, which is associated with osteoporosis, which you can read about over here. Turner syndrome, osteoporosis due to decreased bone mineral density. Question 27. A 6-year-old boy who has chronic cough, respiratory infections, and poor weight gain, and there's a problem on 508 on the CFTR gene. This is affecting, of course, chloride ion transport. That's why parents who kiss their children with cystic fibrosis may complain that it tastes like they're kissing something salty. And you can read about that over here. Disruption in chloride ion transport channels. Question 28. A 1-year-old girl who has these symptoms of hepatomegaly, hypotonia, liver biopsy shows fibrosis, and abnormal glycogen with fewer branching points compared to normal glycogen. So we're not getting the branching enzyme. There's a problem with glycogen synthesis due to Anderson disease. This question actually wasn't amazing, but there's a problem in glycogen synthesis due to Anderson disease, glycogen storage disease type 4. Remember, A, B, C, D. Anderson, branching, Corey, debranching. In Anderson disease, there's a problem with branching enzyme, and therefore we're going to have fewer branching points in glycogen synthesis. Question 29. A 2-year-old girl who has regression and a problem with the MECP2. This is Rett syndrome, where there's a problem with DNA methylation regulation, which you can read about over here. Question 30. A 2-month-old infant with irritable and musty odor. This is PKU, which is a problem with phenylalanine hydroxylase, which you can read about over here. PKU due to deficiency of the enzyme phenylalanine hydroxylase. This enzyme is required for the conversion of phenylalanine to tyrosine. That's why these patients, their lab values have elevated phenylalanine. Question 31. A 5-year-old boy who has vomiting, lethargy, and confusion. There's a problem with an enzyme involved in fatty acid oxidation. So basically this question is asking which of these enzymes involve fatty acid oxidation. So if you have a good memory, unlike me, you'll remember that it's C, medium chain acyl-CoA dehydrogenase, which you could read about over here, but this topic is way too boring for me to discuss. Question 32. Here you have a 16-year-old girl who has blah 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 hexagonal crystals. These are the cysteine crystals. This is cystinuria, hexagonal crystals, recurrent cysteine stone formation due to increased cysteine excretion, which you can read about over here. Question 33. Oh, we have another salty cystic fibrosis question. Here is just asking the mutation is on the sifter gene, a point missense mutation at 508 position on the sifter gene, which you can read about over here. Question 34. Darkening of skin, decreased libido, hepatomegaly. This is hemochromatosis. Hemochromatosis causes bronze skin, hypogonads, and cirrhosis due to iron overload. Hence, the iron overload, which we see over here. We see the bronze-colored skin, the hypogonads, we see the hippos by his gonads, and cirrhosis. And by the way, the dyed beads that the other guy in the gym is wearing reminds us of diabetes, the Diabetes Association. Question 35. 45-year-old woman who has blistering lesions on the back of her hands, which get worse with sun. This is porphyrinia cutaneous tarda due to uroporphyrin decarboxylase deficiency, which I have an awesome mnemonic on my website about, which will be released hopefully in a few weeks. Uroporphyrin decarboxylase deficient in porphyrinia cutaneous tarda, blistering skin lesions on the back of the hands in the sun. Question 36. 28-year-old lady who has eye irritation and scaling around her nose and mouth, angular chylosis, and magenta-colored tongue. These are describing vitamin B2 deficiency, which I have an awesome mnemonic on my website about. You can take a look over here when it's available. Alright, question 37. We have a 3-year-old girl who has hepatomegaly, muscle weakness, and delayed growth. A liver biopsy shows abnormal glycogen with short outer chains. So here we have a glycogen storage disease again, either a branching one or a debranching one. But the fact that there's glycogen with short outer chains tells us that we have chains, we just can't get them off. This is a debranching enzyme problem. Alpha-1 glucosidase, i.e. Corey disease, which you can read about over here. This is glycogen storage disease type 3. Question 38. Here we have a patient, again, with either a vitamin B12 or folate deficiency. More like a vitamin B12 because of memory and concentration problems, which occur more in vitamin B12 deficiency. So what's most likely impaired? Conversion of homocysteine to methionine. Again, this is vitamin B12 deficiency. And in my question bank, which you'll soon have access to, I'll go through all the wrong answer choices. Question 39. Lens dislocated, downward and inward. Remember, Marfan syndrome up, homocysteine down. And which vitamin deficiency leads to homocystinuria? Vitamin B6, pyridoxine. Could lead to homocystinuria when there's a vitamin B6 deficiency, but here it's actually caused by a deficiency in the enzyme cystathionine beta synthase. Question 40. Here we have RNA converting into a complementary DNA and then the DNA is amplified to quantify the expression levels of specific genes. This is, of course, reverse transcriptase PCR, which you can read about over here. Question 41. How is glucose transported across the cell membrane? In such a way that at high concentrations, the rate of transport reaches a maximum. This is facilitated diffusion through helper proteins, carrier proteins. Question 42. 5-year-old boy with muscle weakness and fatigue. He has low plasma carnitine levels. That's important for fat transport. So he has primary carnitine deficiency. What's going on? Defective beta oxidation of fatty acids, because into the mitochondria takes you in where they can be used for energy metabolism. And since we don't have that, we have defective beta oxidation of fatty acids. Question 43. A 6-year-old girl with scurvy. What's impaired? Hydroxylation of proline and lysine residues, because that's what vitamin C does. Hydroxylates proline and lysine. For collagen, scurvy. Question 44. A 35-year-old man with fatigue and jaundice. Low levels of G6PD of the pentose phosphate pathway. And what's going on over here is that there's a problem with conversion of glucose 6-phosphate to glucose to 6-phosphogluconolactone, part of the pentose phosphate pathway. And this is why patients with G6PD deficiency have the response that they do, because they're unable to generate NADPH from the pentose phosphate pathway, and NADPH itself is used to regenerate glutathione to protect against oxidative damage, which you can read about over here. Question 45. Man with fatigue and pallor, hemolytic anemia, low levels of NADPH. And we're just asking what the purpose of the pentose phosphate pathway in red blood cells, as they just mentioned, for the reduction of oxidized glutathione to protect against oxidative damage. You can read about that over here. Question 46. Guy is drinking. Why would he get hypoglycemia? Because of impaired gluconeogenesis. Alcohol inhibits gluconeogenesis. And you can read about that over here. This could lead to significant hypoglycemia. 47. Cat-like cry. Kriducha. Deletion of 5p. Here's the cat. Kriducha. Cat cry sound intellectual disability. Deletion on the arm of chromosome 5. And patients sometimes have a ventricular septal defect. Question 48. Blue sclera. Hearing loss. Osteogenesis imperfecta, collagen, mutation in the gene encoding collagen type 1, osteogenesis imperfecta, which you can read about over here, an autosomal dominant condition. Question 49, brittle hair, poor muscle tone, Menkes disease, ATP7A gene, which you can read about over here, but I prefer to see the picture. Here, the Menkes disease picture, the men flying on the keys for flying Menkes, towards the boy with the kinky brittle hair, about to trip over the copper, which was unable to be absorbed, right under ATP7A on the wall. ATP7A gene, not a mnemonic, but at least a fun visual. ATP7A. Here we have Menkes disease. Question 50. A 3-month-old infant with strange facial features and VLCFAs that are elevated. This is Zellweger syndrome. It's a severe genetic disorder with significant developmental delays and poor prognosis. Alright, 51. This 1-year-old girl with coarse facial features, gingival hyperplasia, joint problems, and elevated lysosomal enzymes in the plasma. So we have a problem with the lysosomes. This is eye cell disease. In eye cell disease, there's a problem with tagging mannose 6-phosphate, leading to the misdirection of lysosomal enzymes to outside the lysosomes, leading to lots of damage and cellular waste outside where they should be, in the garbage dump of the lysosomes. Question 52. A 7-year-old boy who has hepatosplenomegaly and his crinkled paper appearance of the lipid-laden macrophages. This is Gaucher disease, glucocerebrosidase, one of the 3 conditions that they like to associate with Ashkenazi Jews: Gaucher disease, Tay-Sachs, and Niemann-Pick disease. Gaucher disease. 53. This 20-year-old man who has these dots on his skin, these angiokeratomas, and neuropathy. This is Fabry disease, caused by alpha-galactosidase A, which I have a fun mnemonic on my website, and you can read about it over here. The condition, Fabry disease. Question 54. A 6-month-old infant who has cherry red spots on the macula and hepatosplenomegaly. So this is not Tay-Sachs, this is Niemann-Pick, because there's hepatosplenomegaly, and that's how we often differentiate the two, at least on exams. So Niemann-Pick is caused by sphingomyelinase deficiency, leading to the accumulation of sphingomyelin in various tissues, leading to the symptoms. 55. Here we have a 2-year-old child with progressive muscle weakness, difficulty walking, and developmental regression. There's diffuse white matter atrophy, and there's an accumulation of sulfatides. So a real sulfatase A in metachromatic leukodystrophy. In metachromatic leukodystrophy, which you can read about over here. I accidentally put the question in the box, so don't read about it over here. But this is metachromatic leukodystrophy caused by a real sulfatase A deficiency leading to neuropathies and white matter atrophy in the brain. This is metachromatic leukodystrophy. Alright, question 56. A 25-year-old woman who has fatigue, irritability, and numbness in her feet. So this is a peripheral neuropathy. Not the burning foot syndrome seen with vitamin B5 deficiency. That's very rare. There's a peripheral neuropathy, and that's vitamin B6. And you can take a look at the rest of the question and the explanation over here. Let's move on. 57. A 15-year-old boy who has difficulty walking and falls. He has pes cavus and nystagmus. Has trinucleotide repeat expansion disorder, Friedreich's ataxia, GAA, G-A-A. leading to cardiomyopathy, and that is the most frequent cause of death in Friedreich's ataxia caused by the trinucleotide repeat, GAA. In my video, garlic bread for Friedreich's ataxia. 58, which organelles are responsible for lipid and detoxification of certain chemicals. Oh, I was supposed to have an image here and I forgot to put it here. There's lipid and detoxification, smooth endoplasmic reticula responsible for lipid synthesis. Smooth endoplasmic reticulum. 59. Again, I forgot to put the biopsy, but basically, there's an organelle showing a problem. There's an organelle responsible for oxygen energy production. That's the mitochondria, also responsible for ATP production. This is the mitochondria. Sorry, I forgot to put the biopsy over here. I'll edit it in my question bank. Let's move on. Question 60. What does atorvastatin do? It inhibits HMGA-CoA reductase. This reduces the production of cholesterol, leading to lower levels of LDL, the bad cholesterol, LDL. 61. How is energy released when we break apart the ATP molecule? It's the third phosphate group, the gamma bond. Question 62. Which amino acids is directly involved in the synthesis of ALA? Actually, I mentioned this. This is glycine. So we have a repeat question over here. Question 63. Elevated phenylalanine in the blood. Again, this is PKU, phenylalanine hydroxylase. 64. Megaloblastonemia and elevated homocysteine. Amino acids metabolites that are affected is methionine, because vitamin B12 is responsible for homocysteine to methionine. 65. There's a vitamin affecting blood. This is vitamin K, which you gotta know, which is also known as phyloquinone. Vitamin K leads to bleeding. Question 66. Which steps of glycolysis requires NAD plus as a cofactor? Glyceraldehyde 3-phosphate to 1,3-bisphosphoglycerate. An annoying fact you gotta know, but I'll have some fun mnemonics for this on my website. You can read about that over here. Question 66 again, apparently, about aldose reductase. Question 68, I guess I left that question 67 in this quick video over here. But how does cortisol exert its effects? Well, it's a hormone, and therefore it binds the intracellular receptor to alter gene expression. You can read about that over here. Question 69, misfolded proteins in this man with Parkinson's disease. That's due to a disruption in the ubiquitin proteasome system, leading to this buildup of misfolded proteins. And question 70, in patients with pyruvate dehydrogenase deficiency, these patients need lysine, a purely ketogenic amino acid. So if these patients take lysine, or they have lysine in their diet, it can help provide energy without increasing the blood lactate levels. And this mitigates some of the symptoms associated with pyruvate dehydrogenase deficiency. Alright, so that's the first 70 questions. Remember, we're going to have many more added to our question bank. The videos you'll have access to at my website, but I'll keep you informed about all this. I really hope you enjoyed this video. Stay in touch, stay tuned. Alrighty, take care.